we're recording this meeting, so your continued participation is basically giving consent to be in the meeting, because I know not all family members can make one of the scheduled meetings. So I felt it was important that we record it and put it out on our website so all family members can have access to that. As a reminder, we're not going to get into resident specific issues and concerns. If you have really specific care issues, please reach out to your social worker or your loved one's nurse manager. So starting with that, I'll just kind of give you an update of where we are and what we're hearing. As you know, the COVID cases in the state of Vermont are increasing. I listened to Governor Scott's COVID press conference yesterday, and he has some pretty strong words about the importance of not going to bars, not going to parties, and no inter-family meetings or gatherings. What hasn't changed yet is our ability to do indoor visits. Secretary Smith, who is the head of the Agency of Human Services, did state that he is working with their attorneys to request a waiver to the CMS or the federal requirements that allow indoor visits. His statement was that he feels that the CMS requirement that visits get suspended at 10% of a community positivity rate was too high, and they are seeking something lower. Peter King and I have talked at length. At this point in time, we're not going to stop indoor visits. If something happens in Bennington County where we see a big surge, or of course we get direction from the state or federal government to suspend visits, then we will not have a choice but to follow those requirements. I know that's news none of you want to hear. It's not news I want to give, but I wanted to make sure we were all on the same page as to where we are with that. Before I move from indoor visits, is there questions, comments, concerns, things you'd like to bring to our attention that we can address with that? Melanie, I saw you talking. Okay, I can hear you now.
I have an issue with Len as far as being afternoon visits. I have talked to you, Bliss, about it, and he was a little bit better last week when I came, but he still is not focused on the time of the visits is the issue.
Right.
And I don't know as later on in the afternoon is going to be any better, but coming from across over the mountain, I really don't want to make it too late is what my issue is.
Right. And I know it's the weekends that we have the morning visits. During the week, we do not. That was a conversation with our staff in terms of having the ability to get everyone up, dressed to breakfast, and available for morning visits. They were really struggling with. And we continue to look at that. Prior to this surge, I had hoped to add where we could have 2 people visit at the same time in our visitation rooms. That's not an option at this point.
Right, I understand that.
Yeah, I continue to look at it, and I continue to lay awake at night trying to figure out how I can make it better for everybody. Never in the 25 years that I've done long-term care did I think I'd have to tell a family member they can't visit.
Right. I do get it. I really do get it, but it just is, it's hard to, try and, being that I'm the one making most of the conversation, trying to keep him awake during it so he's not, after lunch he's thinking about a nap. Right. But I do get it.
Okay. And we will continue to look at it and talk about it.
Okay.
I wish I had a better answer, but that's where we are right now.
Okay.
Other questions, concerns, comments about visits? Whoever's with Melanie, you're on mute again, so I can't hear you.
Oh, it doesn't say.
Okay,
Can you hear me now?
Yes, I can.
Yeah.
So I was curious about the possibility of bringing dogs or a dog.
Yeah. We are not doing pets at this time, mainly because of allergy concerns and the frequency of one visit, a break, and then another. So your loved one may not have an issue with an allergy, but someone coming in after them might. That's where having true indoor visits and your ability to go directly to your loved one's room with a pet has been, was allowed in the past. And right now we haven't been doing that. It's something that Peter and I can talk about further at some point. I don't know what your thoughts are on that, Peter.
Yeah, I think that is something we could potentially look at with outdoor visits. That's, much more of an option. We in Vermont have much more limited options for outdoor visits over the next 3 months or so. So, I mean, those are the primary concerns. I mean, I much prefer having pets available for folks because of the connection, the response, and it's just really, really, I think, can be a valuable adjunct to a visit. But that stays on the agenda certainly, and certainly the timing of the visits does as well.
Okay. I was slacking and didn't admit 2 people, sorry. Any other questions or concerns?
I have a question.
Sure.
I come from 3 hours away, and the last 2 times I've called, I've been told I couldn't get in to see. How and when am I ever going to be able to call and make an appointment to see? Because now you're saying only one person can use the room. You only have a couple on the weekends, and only one person can use the room. I've called 3 times and I've been told no every time. So I don't know how I get put on the schedule. I don't know. So with the weather being the way it is in Vermont, I try to do it when I know there's going to be a nice day, or because I travel 3 hours down, sit for 30 minutes, and travel 3 hours home. So it's 6 hours in the car for half an hour of visitation. That's tough.
Okay. So you're calling Mary Smith and she's saying no because the times are already taken?
3 times, twice. No.
Okay.
Yep.
All right. I will talk with Mary and see what we can do. I know the visitation is tight. We can't go weeks out and schedule visits because we have to ask.
Well, that's happening because she says, I don't have anything until 3 weeks from now. So I don't understand that process.
Yeah, then I'll be talking to her about, yeah.
And I called and I said, well, what about next weekend? What about next weekend? And I was told no for 3 weeks. And I'm like, okay, then that's not what you say on your website, saying that you're going to schedule once a week.
Right. I will definitely talk to her about that because it should be once a week, because those COVID screening questions that we ask you there plus here need to be
and
current.
It should be rotated. If one person hasn't seen their loved ones in 3 weeks, then maybe we need to be looking at rotations.
No, that's a good point.
Because is it the same people getting in to see their loved ones in the same, I know it goes by hallway or goes by house, but okay, if I haven't seen him and my brother hasn't seen him, then he hasn't been seen in 3 weeks. And my brother lives right there. He tries to go on Tuesday nights and he's being told no as well. So
okay.
I just have concerns that I'm not getting a fair shake at seeing my dad and he hasn't seen us in a while.
No, that's a legitimate point.
So
but I will definitely look at the list. No, we can.
Is there a possibility of doing like set visits? Like for example, maybe for us, for example, we get twice a month and or I don't know what the timing would be, but once or twice a month where fitting in more people, but maybe the visit can be a little longer because we don't travel 3 hours, but we travel an hour and a half. And it's for 30 minutes that isn't, we love to look at them, but it's kind of hard to have a visit before we're done and having to leave.
So extending the time is probably something we cannot do because we're already stretching the regulations. Because there was a lot of feedback when I initially talked about doing indoor visits and having it be 15 minutes. And I heard from family members. So I agreed to the half hour. The day I agreed to the half hour, we got the recommendations and from Licensing and Protection, who gives us our license, saying visits should not be more than 15 minutes. So we're saying because of the size of our room, we can push a half an hour. I don't know if Peter, I can talk about, can we push it longer? We're already pushing that boundary. but that's something we can, Peter's got a direct line to the Vermont Department of Health. He's great about calling them when we need some clarification. He's been a great advocate the whole way around, but that is something we can look at, and something about potentially set visits. I'm taking notes. I don't mean to be looking down. Okay. Any other questions, thoughts, suggestions, concerns around visits? Okay.
I'll just say that, you know, we're, one of the challenges, one of the many challenges of this is trying to balance what the regulators who really make firm rules and guidelines for us, but it doesn't necessarily apply to every single, excuse me just a second.
Peter shares an office, so someone's walking in now.
Yeah, which is why I'm wearing the mask. But everybody just, oh, there we go. So we're constantly walking the line between what our regulators say we need to do, what we want to do, and using common sense. So for all these things, it has to do with, you know, for dining, for activities, for everything that we're trying to manage. That's been one of the huge struggles. Some areas there's very clear guidance. In other areas there is not. And then as the context of the situation changes dramatically, like it is now, then we're always struggling, because this is much worse than it was in April. And in April there was no visits, you know, really no activities, nobody coming in. You know, and so if we were going by the criteria in April, there'd be no visits whatsoever right now, because there's been some increased research, knowledge, and we've learned the 4 things that you can do to prevent the spread of COVID, and that we've had enough experience to know that those things work. We implement those, and in that sense, we've been able to continue the visits we have been able to do. If Vermont has another week of acceleration like we experienced over the last 7 to 10 days, you know, I'm sure other measures will be implemented to help offer an additional layer of protection. You know, I really appreciate the opportunity to hear about what things are like on the other end of trying to get a visit and trying to arrange a visit. Because it's one of the most heartbreaking things to have to even talk about the details of this kind of thing in a situation to people's family members. I mean, it's never something we've had to do in the, you know, in my 25 years of being here. So recognize that it's hard for us, but it's also essential for us to hear from you about the specifics of it, because we really need to make sure that, you know, someone needs to drive from 3 hours, that we figure out how to make that happen. You know, the longer visits probably aren't going to be possible in the short term. We know that the risk of spreading COVID, you know, is related to viral dose and duration of contact and proximity. And none of us knows, you know, if we have it. We all come to work assuming we're asymptomatic infected people and try to behave accordingly. And we just, and that's why all the restrictions with other people when they come here. But you know, that's part of the struggle, and part of why you see there's such variation over the course of this pandemic in terms of how we manage it. One way we try to ensure the most consistency is our collaboration with other nursing homes in our town, and then through extension of the Department of Health and the Vermont Healthcare Association, we communicate and have regular meetings with staff of all the nursing homes in Vermont. You know, and this is one of the few states where, you know, where I have the cell phone number of the Commissioner of Health. And who actually answers when I call. And so, I feel that with that support, that we're able to make decisions based on broad guidelines that may not really say exactly what we need to do in this particular situation, but by collaborating with the Department of Health and other experts in our field here, that we try to come up with things that make sense. But working out the nitty gritty, it's essential that we do this. And I think this format I like a lot. So I'm hoping we can continue to do that over time.
I also have another question. If we're only allowed to have one person in the Namaste room, for instance, where Lynn is on Brandon, why couldn't, like Melanie and I, come and bring one of the kids with us at the time to, I know that's adding 3 people into the thing, but I mean, if you're having issues with trying to get everybody, able to have time to visit their loved ones, if that might be an a resolution to it.
So that the max number of visitors was set by licensing and protection and the Vermont
Right.
Department of Health.
Right, I know that, but I mean, if
I know.
somebody's having trouble getting in, I would think that would be maybe something that they could look into.
But, so, yeah, if we can attempt to have a conversation with them, they're basically going to refer us back to the guidelines. Because actually what they say the guidelines are the minimum that we have to follow. We can make them stricter, which that's not our intent at all, but we have to follow at least that. We do have a call with licensing and protection Friday morning. So we will bring these concerns to the powers that be that are there, that write these regulations. So this is good timing for us to meet so we can share that with them. So I'll write myself a note or I will forget. Okay.
So at this time, is it only, everything's the same, nothing has changed since the new regulations or the new notice came out from the governor on Friday, except anybody from out of state can't come in at this time to visit, right? Or
Correct.
anybody in a red zone, which we're now a red zone. But we're still able to visit our
Right.
loved ones once a week, 2 people only for, what's
30
the
minutes.
time?
30 minutes right now.
30 minutes, okay.
Yeah.
And you don't see that, you can't control whether that changes or not
Exactly.
going forward. And I have, I've been fortunate that I've been able to get visits every week, and being a very frequent visitor for my dad doesn't make a difference, but it's very important to me to make sure that I get in weekly when it's allowed, because he was used to seeing me, a lot through the week. I'm fortunate to be close, but, it's important to me to be able to get in every week. So if there's a way that, I just think it's important for all residents to have that option. And I know it's almost an impossible feat for you guys over there. I guess my question is it because you don't have enough staff to manage that many openings? Are you looking for people that maybe aren't as, maybe not necessarily LNAs, maybe buddies that can help out with that in the evenings?
We are looking at that. I had a conversation with Dr. King, I think it was 2 weeks ago, and now jinxed us. I'm like, hey, things are looking good. Can we look at bringing some of our volunteers in? Because we had some people who want, even family members who said, hey, I'll volunteer to do visits, supervise visits if we can have more. And then the bottom fell out in the past 2 weeks.
Yeah.
So
If I can, I would be willing to help out with that, being local, just as an option.
I've even gone so far as to increase the amount of overtime staff are allowed without them having to call me to get permission for overtime. So we are looking at options. It's the balancing of making sure we have enough staff on the floor to do care and support visits. It's a tight rope to walk. We're doing an intensive screening with all of our employees when they come in, and on any given week, we have 2 to 4 employees out pending a COVID test because they answered yes to one of our many screening questions. And thankfully, we've only had that one positive employee back in March. So we balance that as well. Yes, Mr. Gary, I see your hand.
Yeah. Hi, Melissa. The question I'm going to ask is related to the conversation we're having right now. Are volunteers permitted in the facility? Because I know here in the Upper Valley, no volunteers are permitted in healthcare facilities at this point.
Yeah, they're not here either. The guidelines they gave us initially gave us some flexibility with that. We could determine who an essential healthcare worker is. It would be hard pressed to explain to licensing and protection why a volunteer is an essential healthcare worker. So we've been trying to be creative and work our way through those guidelines without getting us in trouble. So.
Yeah, we're really looking forward to the day when we can reintroduce volunteers because they provide many great functions. Just that right now, we'd be hard pressed to explain how we could justify it with the escalating community prevalence.
So the holidays are fast approaching. They're here next week. Recreation will be here on Thanksgiving Day. So if you'd like to arrange a time to do a FaceTime with your loved one, reach out to Michelle Burgess and she will do her best. She'll like to schedule those as much as she can. And, we know that, holidays more than any other day of the year, it's important to have that family connection. And I know that virtually it's not the greatest, but we're offering that as a potential connection. I can't see my granddaughter who lives in New Hampshire, so we're going to FaceTime part of Thanksgiving dinner together to be together. So we're trying to be creative as much as we can so your veterans, your loved ones can still have those connections, especially at the holidays.
Does that mean that our schedule, usually scheduled Tuesday and Saturday, does that mean that that's the days that they have to be, or is it?
No, so on Thanksgiving Day, we're saying for actual Thanksgiving Day, if you want to connect with your loved one, reach out to Michelle. And she's getting a schedule. She's, her staff has, usually they're bare bones, but they've all said, hey, can we work? And I said, of course, because they want to be able to make sure that we can connect as many of our veterans with you guys as possible.
Okay.
So, yes, we just want to make sure we have appointments.
Now she has, is she at the regular number, Mary's number, or?
Yep.
Okay.
Actually, I'll give you her direct number. I have to look it up. Believe it or not, because I have it programmed into my phone. So it's the 447, and then it is Michelle, 6520. But you can call the main number and ask to speak to Michelle.
Okay, 447 what?
6520.
Okay.
And also going along with holiday messages, I don't know if you've seen our Facebook post. Melinda, our marketing director, is willing, if you want to record a message, carols, sing, what have you, and send it to Melinda. We actually have our own in-house television station now, and we want to play those messages on our television station. So it wouldn't be just your loved ones seeing it, it would be all of our veterans seeing the messages, but it's a way to make sure that you guys still can communicate with them.
Okay.
They love those. So if you want to do that, or if you're part of an organization, the Elks, the Lions, what have you, socially distance and not groups more than 10 per the governor's executive order, we would love to share them with the veterans and members. Michelle and her team does an incredible job decorating the building every year. We're also going to focus more on the outside. Obviously, our vets and members we're getting them out as much as possible what the weather allows, but all the courtyards and stuff are really going to decorate for the holidays. We will make sure letters, cards, packages are delivered quickly and as soon as we get them to make sure that they have that continued connection with home. And I know if visits are suspended, that making sure that stuff gets delivered quickly is going to be important. And our rec staff can help write cards and letters on behalf of our veterans back to family members as well. So that is their focus as well with that. And the only other thing I want to touch on quickly, and then I can answer any other questions you might have, is we're hearing a lot in the news about Moderna and Pfizer's vaccines. So where VVH stands right now is the Centers for Medicare and Medicaid Services partnered with CVS and Walgreens. CVS is the parent company of our pharmacy, Omnicare. So we're contracted with them that when an FDA approved vaccine is released, CVS will be responsible for maintaining that. We'll bring it here and we'll administer that to our veterans and members. Just like any other vaccine, we will be sending out informed consents and whatever information sheets that the federal government gives us related to that vaccine. I've had some family members ask if we were going to mandate our employees to receive the vaccine, and the Vermont Veterans Home in and of itself will not be making that mandate. It would have to come from the state or federal government. So any questions or concerns on that, let us know. We don't have a whole bunch of information, but that's what we know at this moment.
I think the turnaround time for those consents, we'll try to do that quickly because it'll be vaccine specific. So we don't have it yet to get started on that, but that will help lay the groundwork. So when we send those out, the quicker we send those out, we'll be able to administer it because those of us who work here and reside here will be among the first in Vermont to receive it.
And I want to reassure everyone, our PPE, our personal protective equipment supply is pretty substantial. Our Darlene and Kim, our two stock wizards, have been incredible in getting PPE for us. The State Emergency Operations Center has been very supportive of us, and we are awaiting the arrival of 11 pallets, 54,095 masks, and then an additional 650,000 surgical gloves that the state of Vermont is doing a bulk purchase that we're part of. So Peter's done an incredible job working with Darlene and Kim to make sure that we have PPE. So I want everyone to be rest assured that we have that. You know, the staff can get access it when they need it, so we're not rationing in that. But we watch it every week, actually every day. So we are right on top of that as well. So.
Yeah, it's a much different situation now. We just had a meeting and well, we're just trying to target areas that that we might be at risk for, but it's nothing like the situation in April where you could order something and they'd say, or they wouldn't even let you order it because they had no idea when it was going to be available. So from that aspect, it's really been much different. We realize we'll go through it a lot faster the day we have COVID in the building. Hopefully, knocking on whatever wood there is, we hope that day doesn't come. But we also have started an aggressive staff testing. We've been testing every month, and we'll be stepping that up. We're engaging with an organization to help us perform our testing that is assisting most of the other nursing homes in Vermont that has been arranged through contract with the state. And we anticipate once testing with them starts, and we'll be starting it imminently the next week or so, we anticipate that we'll be doing it at least twice a month for routine staff testing, because we know that the you know, it's people coming in that will bring it here. It won't start here soon, and so it's all up to all of us to minimize that risk. And this is just one other way of trying to catch that before it produces any symptoms for somebody. So you know, we're happy that arrangements are coming because it's been a real scramble nationally. I mean, we live in a very fortunate island here that we have access to what we do, and that we're not dealing with what Colorado and South Dakota, Florida, and the Midwest that's really getting hammered right now. So yeah, so that's I think a lot of the good news is that the work of the last 8 months has produced many options for replenishing PPE, and then I've already mentioned the vaccine, which is the biggest light at the end of the tunnel.
Any other questions, concerns, feedback that you have for us? We want to hear from you guys. Sometimes we're so knee deep in this that we don't see the forest for the trees, and an idea for visits or something is just out of our realm of possibility of thinking. So if you have those suggestions or we want to hear from you guys, and so let us know.
Well, Melissa, it sounds like I heard longer visits and more visits.
Yes, I have that written down.
That's definitely what I heard.
Yeah.
My hearing's not that great, but I definitely heard that. And
Yeah.
you
And
know,
pets and visits.
and pets.
Well, and so everybody
You know,
can see their loved one, because
Yes,
that's
and fair
not
visit.
happening right now.
Yep.
Right, and equity about accessibility to visits, and
Especially when you're coming from 3 hours. I live in Vermont. I don't live out of state. I live in Vermont too. So
Right.
right.
long drive.
Yeah. No,
But I
everyone.
No,
make-
and
I would make it every weekend if I could see him every weekend.
I know. I mean, we talked about that very situation where, you know, there's people who, like yourself, I mean, live about as far away as you can and still be in Vermont. To get here for such a short visit, it's, you know, it's far less than ideal, and that's certainly goes without mention. But certainly the equitability of that needs to be. We need to address that.
Well, thank you guys for your time.
So I
Thank
have
you.
planned to do this again in December. I'll send out the dates for you guys. I think this is a great give and take. You know, we kind of got into a lull in as things got a little more crazy, and I realized I was sending out far too many emails without the ability for you guys to send feedback. I felt this was a great way to communicate. And on behalf of the staff, thank you. I know this is not easy for you at all, not to be able to be here with your loved one, and it keeps me awake at night. But thank you for trusting us, and thank you for your open communication. I've had family members call that just need to vent and do that, because, you know, we're all feeling that frustration, and but I can't thank you enough for trusting us with your loved one.
We have a question.
Okay, go ahead.
Are there any guidelines on sending packages?
Nope, we haven't instituted any. I know that there are some nursing homes that are saying you can send your package, it has to sit somewhere for 7 days. We have never gotten that strict unless we
Okay.
receive guidance from somebody. It's mail, flowers, you know, we're allowing all that. That's, you know,
Okay.
that's, you know, that connection's important.
Good.
All right. I'm only a phone call or an email away. Feel free to call any of us. You know, we're here to help, and any suggestions you have to make your visits better and, you know, the lives of your loved ones better, please reach out. We really appreciate it.
Thank you.
Thank you.
Thanks.
Thank you.
Take care, everybody. Stay safe.
Thank you.
All right. Bye bye.
Good night.
Good night.
Night.
Night.